all the participants.
This meeting is being recorded.
All the participants in the room today, and I know that again, your partners, your enrollment assisters, Adam and I are going to do our very, very best to make things clear to everyone. If you find that we have used an abbreviation that you don't understand, we're really going to try not to do that. We want to make for sure that there's a learning opportunity for everybody, regardless of whether you do direct enrollments or you work with partners that express that they're needing health insurance. We want you to know that there's opportunity for referrals throughout the whole entire year outside of open enrollment. There are 40 more weeks until or 40 weeks in between open enrollment and the next opportunity to get enrolled. And families are dynamic. People change jobs, they get married, they have children, they move. There's all kinds of things that trigger the opportunity to get enrolled outside of open enrollment. And we hope to make this this opportunity here today so that you can hear these opportunities and flag these referrals as you're working with people. So we know that the marketplace has back up a little second, Adam, not quite there yet. The marketplace has a screening tool, and it helps people identify recent life changes. So if you're lucky enough to actually get to the healthcare.gov website, sometimes that screening tool doesn't seem to encapsulate your story. It doesn't take into account the nuance or the complexity of some people's journey to getting health insurance. And I don't mean my journey into health insurance. I mean the literal winding path with barriers and poor signage and confusion that a lot of people take in trying to get health insurance outside of open enrollment. So again, Adam and I are going to hopefully share some of the qualifying events and triggers and how to get people enrolled outside of open enrollment. All right. Go ahead, Adam. Thank you.
Great.
Some of the basics, again, are that there are qualifying events that trigger the opportunity to either enroll newly into a marketplace plan or choose a different plan outside of open enrollment. And these are triggered either when an individual or a member of the family experiences a qualifying event. Now, some of these qualifying events require that you verify that you had coverage beforehand, and some of them don't. So we're going to look at all of those opportunities to get enrolled. Go ahead. Some of the key terms we're going to be talking about today is minimum essential coverage, and we're going to be dropping in a chart from the Beyond the Basics policy forum that provides great resources. Many special enrollment periods require that you have prior coverage before you are allowed to enroll in a new plan. Some allow you to select a plan or let the marketplace know even 60 days before you have that qualifying event, or up to 60 days after that event happens. We're going to talk about coverage dates, how regular coverage dates are listed in the SEP chart we're going to look at, and some policies that may take effect in 2022 that will accelerate those effective dates. And then we're going to talk about how these are triggered, whether or not they happen automatically in healthcare.gov application or by calling the call center.
Great, thanks, Julia. So first we want to cover just loss of health coverage, because this is, at the most basic level, what we see the most, I think. Typically when people are going to the marketplace outside of open enrollment, it's because they've had a life event, a change. Typically either we see a loss of a job and job-based insurance, or loss of, say Medicaid or Badger Care coverage because of things like income. But there are a lot more than that. And even in the loss of health coverage, there's some nuance, including whether it was through a divorce or somebody leaving the household or somebody passed away. Similarly, there's a lot to say about COBRA coverage, COBRA being the continuation of health coverage after you have ended a job or ended employment, where you can either get coverage right away as soon as you say, okay, I have lost my main job coverage and it looks like it's switching to COBRA, and you could sign up through the marketplace with the special enrollment period then. Or later, if your employer continued paying premiums on your COBRA coverage and suddenly they stop and you end up looking like you're going to pay full cost, you also have a special enrollment period then. We often see children aging off of their parents' plans when they turn 26. That is also a pretty common one. And then, as I was saying before, losing eligibility for Medicaid or CHIP, typically because of income. And we'll see some more reasons and nuance around that topic as well. So this is the chart that Julia was referring to, and don't try to read this. It blew up nicer than I expected it to, but it's still very small. And please use the one through the link that was dropped into the chat. I believe it was by now. But just so you know, this is an excellent resource for you, whether you're a new or veteran assister, or just trying to get a handle on special enrollment periods in the marketplace because of someone you're talking to or working with. The categories are what's most important here, because these are the ones that Julia was just referring to. We have the qualifying event. Well, you'll see just how broad this category is for loss of minimum essential coverage. It's really important to remember that it can be, a spouse or a dependent. There can be other people in the household whose situation, the changes, the loss of a job, the loss of coverage can trigger the special enrollment period. It doesn't necessarily have to be the main person on the application or the head of household. Also, I'd just like to make a note here that the marketplace, for their language, they also consider the spouse a dependent. So their language, just so when you see dependent, they're also talking about spouse when you're looking at marketplace materials. We're going to be talking about all of these in relation to different special enrollment periods, including the requirement of coverage. That's a really important one, because a lot of the SEPs, and it's been adding over the years, have a requirement that you've had coverage before. And some of those will allow you to see the timing category, act proactively and secure your marketplace coverage before you lose it, and then there's no gap. But most of them also, if you say didn't find out about the marketplace until later, or you didn't explore your options right away, you also have 60 days after. In that case, you would have a gap in almost every case, but you'd still have that option. Effectuation dates, coverage effective dates, really important, especially this year. So that means basically whether or not it's going to start right away, no matter when you enroll, or if it's going to start the first day of the month after, or the month after that. So it's really important to pay attention to those. In 2022, CMS has said that they're going to change effectuation dates. So coverage starts right away, pretty much for any SEP, as I understand it. I don't believe those have gone into effect yet. I've heard that they might have, but until I see some clear guidance from CMS that says yes, green light, I'm not gonna say that is for sure happening yet, but it's supposed to in 2022. And then plan selection limitations. Some of these special enrollment periods allow people to change plans, and I know Julia alluded to that just a little bit. There are reasons to do that, and there are populations that can do that more easily than others. But generally speaking, people tend to get locked into the same metal tier category for most special enrollment periods, but there are some exceptions. The important thing for assisters now, these are all going to be granted, for the loss of coverage, is through the marketplace application. And that's what we want to pay attention to, is how they're granted. Some of these are going to have very specific triggers at the call center, but most will be just through answering the application questions using the information you have available to you from the consumer. All right. So looking at these further, so exploring this table a little bit more, kind of alluded to some of these. It's important when you're working with consumers to listen, right? You're listening for certain triggers. You're listening for certain flags as you do this work. And special enrollment periods, you kind of think of them, break them down into categories. For example, the loses employer coverage due to, and then this is a loss of a job, but it can also be, again, voluntarily quitting a job, which is important to note, because sometimes that seems really maybe perhaps basic, but sometimes when you're deep in this work and you see a consumer who's presented and said, I want to end my job and my coverage will end, sometimes it just doesn't seem like that should trigger a SEP, but it absolutely does. And the way I always think of that is, nobody can force you to keep your job just to keep your insurance. That's not a thing. So they will basically, anytime that job-based coverage ends, they're going to be able to go ahead and get marketplace coverage. And again, they can act proactively on that. Loses eligibility for Medicaid or CHIP. Again, you're losing your eligibility for Badger Care. We'll see a lot of that with the PHE unwinding coming up at the end of this year or later this year and rolling into next year. This is probably the second most common one, or maybe the most common one. It's hard to say, due to typically, 90% of the time being over income. I think that's what we see more than anything else. COBRA coverage, we alluded to a little bit. Again, that's whether it's starting or it expires. So if the full cost kicks in and someone's going to have to pay those full premiums, the difference between say $60 and $800, then they will have a special enrollment period to get into the marketplace. Then we have some more interesting ones related to loss of coverage. So you have people who may be getting divorced and their coverage situation is changing. You have people who might have been on a student health plan that ended with a semester that counted as minimum essential coverage. And Julia will talk about minimum essential coverage in a little bit here. And then again, things we've seen, people aging off their parents' plans. This last category is a little rarer, or a lot rarer, maybe I would say. And that involves typically the plan changes beyond a person's control. The plan itself ends, or the group plan is canceled. There we go.
So it can be really difficult to determine whether or not a plan is considered minimum essential coverage. And again, Beyond the Basics has provided a handy dandy chart. Most employer-sponsored coverage is considered minimum essential coverage, including grandfathered plans. And remember, when we're assessing for coverage, we're not only looking to see if it is minimum essential coverage, the combination of is it affordable and meet minimum value standard. Those definitions are pretty good in healthcare.gov. Minimum value standard means it covers at least 60% of costs. But the easiest way to determine that is to ask your person to go to their HR department and get their actual summary of benefits and the piece of paper that shows the rates that they'd be asking to pay for that plan. And that will help you determine the affordability. And the last sheet, typically, of the summary of benefits has a question that says, does this meet minimum value standard, yes or no? And that can be really helpful for helping you determine that. Individual health plans on the marketplace or outside of healthcare.gov, including student health plans, are considered minimum essential coverage, as well as the government-sponsored coverage like Medicare, Medicaid, VA coverage, TRICARE, and refugee medical assistance. There are more, and again, I encourage you to download the chart.
I can't talk about minimum essential coverage without talking about what has been termed junk plans. That's not the official name, but that's what a lot of us as sisters end up calling them, which refers to these standalone plans, fixed indemnity plans that are only paying certain benefits for certain things, plans that have a lot of limits, limited short-term duration plans, which is going to be, short-term duration could be up to 364 days. Which is one of the reasons we typically call these junk plans. It's not so much that they don't have a place, it's that they often get marketed as full insurance. They often get marketed at the same times as marketplace open enrollment, or to people who may be losing their jobs and things like that. So it's really important that you look at these using the same language and tools Julia just mentioned. If you get a summary of benefits or you get a plan document in front of you and it clearly looks strange or says this is not minimum essential coverage, it may be one of these. Sometimes you'll see language on there that says, does this satisfy the individual mandate? We might not be using the individual mandate much anymore because it's just not been required at tax time, but if it says no, you have a good indication that it is not minimum essential coverage. And we'll talk more about these and how they can play a bigger role in terms of getting somebody a SEP, typically if somebody thought they were signing up for full insurance. But the chart here says if they're eligible for coverage available for tax credit, yes. So these are not, again, full insurance. So if you had one or dropping one, you are going to be eligible for a tax credit, provided you have a SEP. So we'll talk more about the details on how they relate to special enrollment periods in a little bit.
Before we move on, Adam, these junk plans are horrible because these are the people who call who don't realize that they have gone to a website that is not healthcare.gov, that they have called a phone number on the TV and enrolled in something that sounded like coverage. And those businesses can capture a verbal signature. And it's very often that they don't send people materials. You may not be able to get materials that show a summary of benefits or show what is covered. They direct people to find things online. And It's so frustrating for people who realize that they don't have real health insurance. Helping these people identify some other SEP to help them gain coverage is vital.
Yeah, and we'll give you some tips on how to do that, but absolutely. Again, just the way they're marketed, and people often stumble into them when they're searching for, marketplace coverage or help with coverage is even worse. And then, the phone keeps ringing.
Thanks. So a permanent move applies to people who have moved to a different location, like a different city, county, or state, as long as there's a different set of qualified health plans available in that area. When you're moving to another state, healthcare.gov provides some really clear guidance. Some states use the federal exchange like Wisconsin does, and some have their own state-based exchange. So there are real clear steps in healthcare.gov on how to help someone who's moving out of state. This can also apply to households where their adult children are moving back into the parent's home, or a student moving to or from school or home, people who move for seasonal employment but maintain a home elsewhere. And essentially what's important to remember is that you must have minimum essential coverage at least 1 day in 60 before your move. Now you might move, in the first week of the month. You have had coverage then, if your coverage lasted until you moved on the 7th, for at least 1 day in the month. And so that triggers at least a 60-day period to get enrolled, or up to 60 days after. And the permanent move can be done right in the marketplace application.
Right. And just a note on the timing of these, are so specifically 60 days after the move. This might be something you want to do proactively, but it could be very difficult, especially if you don't have that new address set, to have that new set of plans available to you to show that there was a move. So typically they say up to 60 days after, but if the person's in the process and you have that address, sometimes there's a little wiggle room there, but typically they want you to be applying after the move, although again, you want to try to prevent a gap in coverage. Changes in cost sharing eligibility. This is really important, just overall. So cost sharing being the extra savings people are getting when they're paying co-pays, their deductibles, their maximum out-of-pocket costs, that's all lumped into cost sharing. And those can fluctuate, especially in the silver category for the marketplace. So first, globally, I just want to say, be very careful if you're going to report a change that is going to change cost sharing, because if you have a situation where a fluctuation could cause somebody to have to start part of their deductible over. Maybe the deductible goes up. Obviously, you want to report changes in an accurate and timely manner, but just be aware of the impact of those, because it may cause costs to shift in a way that the consumer needs to be prepared for. And when you report a change in cost sharing eligibility, you can get, it's a special enrollment period. It doesn't necessarily look like a special enrollment period. It's reporting a change, and they may become eligible for changing into a silver plan, for example, to take advantage of that cost sharing, which is really important. So one thing is when you see these, especially newer sisters and even veterans, you might see an eligibility result notice, and it might not look like a SEP, or might not look like you triggered the savings and you don't know what to do yet. Keep going through the to-do list of actually getting to the enrollment and selecting a plan, because you will see those changes in effect there. And you do all of this in the marketplace application. Repayment limits. This is an important part of the discussion, both with SEPs just in general. I have these conversations with consumers often, especially around people fluctuating income, or people who are maybe preparing for retirement and have some control over when things are going to happen. Because oftentimes people want to know, what if I get my income wrong, right? So looking at reporting income and saying, hey, it could fluctuate anywhere between these two numbers. First, you want to identify what those numbers are. And oftentimes it'll put the consumer's mind at ease if I bust out the repayment limits chart and say, this is the most, if you're in this income range, this is the most you might have to pay back. And that really gives the consumer an idea of, okay, my income range is this. I will know more by, say, July, and I will report that change. And if I'm wrong, if something happens towards the end of the year and I end up making more money, this is what I'm on the hook for to pay back. So we oftentimes use it for that reason, for people who are estimating pretty wildly, not necessarily wildly, but pretty heavily fluctuating incomes.
So there are some SEPs that don't require prior coverage, and these are really important to note because it can sometimes create an opportunity to get enrolled if we meet the standards of what this SEP are. We're going to talk about the new low income SAP for households with income below 150% of the federal poverty level, birth, adoption, or placement for adoption or foster care, including the parents who are not physically giving birth, which is something that you might typically not think about. Newly gaining an eligibility immigration status, American Indian or Alaska Native people do not need to have a prior coverage and can enroll at any time in the year. Being determined ineligible for Medicaid, error, misrepresentation, we're going to look at an example of that, and some exceptional circumstances can allow you to get coverage without having prior coverage. So the new low income SEP is not on the chart yet, but it will be soon. And this applies to households who attest that their incomes are below 150% of the federal poverty level. The word attest is highlighted because there's not a requirement to show proof that your income is below this standard, but it may trigger a data matching issue if last year you reported an income of 40,000 and now you're reporting an income of 15,000. The marketplace is going to flag that and ask you to verify why that is. And it could be that you've lost your job, but that's to probably weed out people who are just lowballing the application to get in. We don't recommend that. You must be eligible for premium tax credits based on normal eligibility rules, meaning if you are a person who wouldn't normally be eligible for premium tax credits, this is not an entry in, even if you're low income. It's available now in the marketplace by requesting it or following up on a previously, by the marketplace following up on a previously submitted application. They're supposed to be reaching out to consumers who have applied and have an appropriate income, and they're following up with them. And it should be available to us enrollment assisters in the healthcare.gov application by the end of March. And coverage will begin the first day of the following month, following plan selection. So if you get enrolled on the 29th day, your coverage can start right on the 1st.
Right. So one of the ones that Julia mentioned is being having a newly eligible immigration status or being American Indian or Alaska Native. And these are really important, especially because not necessarily everyone identifies in an appointment if they're an American Indian or Alaska Native. So it's important to ask the right questions. Some do, absolutely, but even a veteran assister can kind of fly through that because it's not something we see in every appointment. So I always want to encourage people to slow down, especially if there's any need for a plan change or anything like that, because those populations are eligible to change plans multiple times throughout the year. And that can be really important to somebody's care depending on the situation. For the newly eligible immigration status, we see obviously a lot of these. I always want to encourage people to be very careful when looking at the different immigration statuses. I find it handy. I always look them up depending on the consumer. I just want to make sure I'm saying the right things and that I'm understanding it fresh every single time. I don't want to make a mistake there. It is important to note that the special enrollment period for gaining a new status, so say you become lawfully present and you show up with the green card or the number, if somebody already had an eligible immigration status and they just hadn't enrolled, that's not going to trigger a SEP. They had to have gone from also not being eligible to gaining an eligible. So the eligible is doing a lot of heavy lifting in that sentence there. The marketplace application has questions for both of these, allowing somebody to just be in healthcare.gov and answer those questions, and it should trigger every single time.
Can I give a pro tip before we move on? When you're putting people's immigration information in the application, when they ask for the green card information, even though some of the fields say optional, you can very often bypass the requirement to send in verification. If you put in not only the A number, but flip the card over on the back and put the card number in as well, if you can identify where that is. There are resources that show you where to find this information on a green card. And putting in all that information sometimes helps the marketplace determine and verify identity faster than leaving it and having to submit documents.
Yeah, absolutely. I will say the flip side of that, sometimes you need to finish an application and you don't have all the information in front of you yet. You can, as Julia said, sometimes those fields are optional. You can keep going. It'll throw up some, yellow boxes and say, hey, do you really want to do this? But you can keep going and you can come back to those documents later if you don't have them in front of you. Okay, so resolving data matching issues. Specifically, we were just talking about the newly eligible for immigration status. So a lot of data matching issues can come up with within this population because they're not known to a lot of U.S. systems. They're looking at these data sources like credit history and other things like that, where they can say like, okay, our system has information on this person. We know who they are. Yes, you could keep going, but you might encounter an identity verification or a job verification. I just want to point out here that a lot of times, because we see people of all sorts coming to us towards the end of open enrollment, obviously, that's the deadline's approaching and people present. It's especially tricky with population where you can't verify somebody's citizenship or identity because it could be the last day of open enrollment. And by the time you get that verified, the individual's window, the open enrollment period will have closed. You can absolutely still get them coverage. Typically, you can do it just by working with the call center or a tier 2 specialist, someone like that. I have seen it go as far as becoming an appeal that you can absolutely win, but it's just an important to if you can get the population, get the person whose status had changed in early, because then you can avoid the whole issue with running out of time for the special enrollment period or open enrollment period and a data matching issue that you have to resolve. This next one is error, misrepresentation, inaction, misconduct. I want to talk a lot about this, especially in relation to something we talked about before, which is those junk plans, because these two things can often go hand in hand. Where you have somebody who was enrolled in a plan, especially if it's the wrong plan, or they did not receive a tax credit or cost sharing reductions. Basically, something went wrong. Either a technical issue with the marketplace, or oftentimes you'll see that a bad actor or somebody who made a mistake helped them and it caused an issue with their application and they weren't able to get the marketplace plan that they should have. It says marketplace application. I think I know why, because that's where the issue happens typically, because you're going to see an issue with the marketplace application, but you should be calling the call center in this case. If somebody had a technical error, or if you think that they worked with somebody who didn't enroll them in the right plan or steered them the wrong way, that can always trigger a SEP. We see a lot of these outside or after open enrollment where people thought they were signing up for health insurance, thought they were signing up for marketplace insurance, and they didn't. The person who was helping them signed them up for something else. The information was misrepresented, and we often help these people in January, February get back into the marketplace before a lot of damage is done paying for something that isn't actually full health insurance under the ACA.
Well, Adam, I want to share with you that I got a call at the end of February from someone who had enrolled through the marketplace call center, and the call center representative talked to her about a plan that cost slightly less than the plan she was enrolled in the year before, but didn't assess her provider network and enrolled her in a QHP that didn't include her doctors, which she didn't discover until she called to schedule an appointment. And we were able to again call the marketplace and cite that there was an error by the call center representative. And this could have gone two ways. If you talk to the frontline person, they will create an escalation. It's called a HICS, a health insurance case system. It goes into the case system, and it could take a week or more to resolve. We got lucky and were transferred right to a supervisor who waved a magic wand and actually helped her enroll into the correct plan. And she would have had the option to either have it start back to January when her regular plan should have started, in which case she would have had to pay the premium to that company that she was enrolling in, that she chose, or have it move into the future where she had her new plan selected for the next month. And that's up to your applicant, what they wanted to do. But there's a case, again, of listening to the story, what happened, how can we resolve this using the opportunities available.
Yeah, that's really interesting one, Julie. I'm used to thinking this usually in terms of like these bad actors out of state, the people we were alluding to before who are marketing plans that aren't insurance, but you're right. It can be a call center staff person through the marketplace. And typically you'll see that because they're very focused on cost, right? That they don't have the education that navigators, agents, and CACs have to talk about these things and really assess people's options. So you will see those mostly because somebody just said, you know, here's the cheapest plan, or here's the cheapest silver plan for you. You should sign up for this. And yeah, provider network is going to be the most common thing overlooked in that situation.
Well, and honestly, you could use your own error as a way to fix something. If you didn't catch something in your enrollment, or you misunderstood and you helped someone get enrolled in the wrong plan, I would throw myself on the mercy and admit my error and see if I could use this to correct it.
Same. And yeah, don't be afraid to do that. You know, the consumer comes first, of course. And Julia alluded to a magic wand too. So sometimes knowing that is possible and knowing that those supervisors can do that and not getting one that will could be frustrating, but you may need to call back and kind of reframe the way you're asking or talking about the situation.
Well, and the key to having that discussion is understanding that this is a thing, that you can request
Right.
this, that it's in writing, that an error was committed and we would like assistance to correct this.
Exactly.
Okay, the FEMA declared emergency came out during, I think it was 2020 or 2021. And essentially, because the whole nation is still under a public health emergency, if you qualify for an SEP but did not get enrolled because you were impacted in some way by COVID-19, then you can request through the Marketplace call center that you be allowed to continue your enrollment. I believe that this would require showing that you qualified for an SEP and in some way that you were impacted. Now, this doesn't necessarily mean that you yourself were ill with COVID. It could be that you were caring for someone who was ill, or your person that was supposed to be helping you get enrolled on January 15th was unable to meet with you. It's really up to the consumer to point to whatever circumstance happened. But here again is the requirement to call the Marketplace call center, explain what happened, and request this SEP.
Right. And this can involve a lot of listening to the consumer story, because they might not be thinking about it in terms of, because they're overwhelmed, right? If they were affected by COVID, it's probably a very stressful circumstance. And you want to help them take a step back and look at it and say, you know, this is why you missed this period. You know, you were in the hospital, you couldn't get there. So yeah, just remember that you could be working with somebody who's under a lot of stress, or who was under a lot of stress, and you want to take it slow and really listen for those circumstances. Okay. So being determined.
Oh, go ahead, Adam. I'm sorry.
Oh, it's okay. I was just saying, being determined ineligible for Medicaid. This refers specifically to certain questions on the application where you've applied for Medicaid or CHIP during open enrollment. So again, we're going to talk about trying to get coverage during open enrollment in a little bit more detail shortly. But basically, if whether you were transferred from the Marketplace to the state, or you started at, access.wisconsin.gov during open enrollment, and you were determined to be ineligible, you will have a special enrollment period for up to 60 days after you get that determination. Now, the SEP applies regardless of whether they apply directly through the Marketplace or Medicaid, as I was saying. It does not apply to individuals who apply directly to the state's Medicaid agency outside of open enrollment. So it's really important, and the questions on the application steer you to this. Did you apply during open enrollment? This is what that's talking about. This is what that's listening for. And we typically see these this time of year right after open enrollment. And we'll talk more. There's some nuance here that we're going to want to get into where applying outside of open enrollment can play a role in perhaps coupling with another SEP. And Julia will talk more about that shortly.
So I want to share with you an example of somebody that I spoke with at the end of February. And she had tried to enroll in the marketplace during open enrollment, but was told by an agent that her offer of employer-sponsored coverage made her ineligible for premium tax credits. And truly, in most cases, that is the fact. And Pam then applied on her own for Badger Care and was denied for being over income. So now it's the end of February. She's missed open enrollment. And through our discussion, she really has no other qualifying life event. So how can we help assess Pam for coverage? First of all, we're going to go back always and exhaust all Medicaid options, looking to see if there's an option to backdate coverage, to review her income. And in fact, she's not eligible for Badger Care. The next point is to actually review her offer of employer-sponsored insurance, because in her discussion of seeking coverage on the marketplace, she said, my coverage is really expensive. So here's where asking for those documents comes in really handy. She works for a very small employer who was offering coverage as a courtesy to their employees. And as a group, they had selected not the lowest cost option, but something that allowed them to have co-pays. And her premium, in fact, would be $400 a month for her age group. And it was considered unaffordable. So therefore, she would have been eligible for premium tax credits during the marketplace open enrollment. So what are our options then with this information? So we could use that error or misrepresentation nod by calling the marketplace and saying that she was assisted. There was an error in that assessment, and we'd like to file an escalation and see if she can get enrolled. The other option, and because I like to work smarter, not harder, is I know that there can be some questions in the application that might help me get where I need to get. And she's provided all the information. I know that she was denied Medicaid. And there is a question in the marketplace application that asks a very specific detailed question that doesn't provide any help text in there. And I want to help explain to you what that asks and how it can open doors. So Michael Cutler works for CMS, and he joined us at our conference in person in 2019 in Sheboygan. And he sat on a panel where we were talking about complex cases. And he let us know that there is a question in the healthcare.gov application that can trigger an opportunity to enroll in coverage. It essentially kind of opens a door. And that question is number 2. Used in combination with me being able to say that she was denied Medicaid, and we used the date that she shared with me that she was denied. But that question in healthcare.gov is, did you apply for coverage between November 1st and January 15th? Meaning, did you apply for any kind of healthcare coverage during open enrollment? And this question asks for an attestation. It asks you to say yes or no, but it doesn't require any additional information, documentation, or explanation. But what can you say yes to? What is that? And by the way, we as a group who have heard Michael Cutler talk and discuss this, we call it the Michael Cutler SEP. It's not an SEP. It's kind of an employment of tools.
Right. Yeah, no, absolutely. I'm sure he's very proud to have his name on it in Wisconsin. So what constitutes a yes, as Julia was just asking? It's broad, but you have to be careful, right? So it means that the consumer has tried to apply, and that tried to apply for health coverage is broader than you think, because it's not necessarily just marketplace or Medicaid. Typically, that's what you're going to see. But there are a lot of things, especially think about all the different, bad actors and circumstances where people are bombarded with information, or people are trying to help them that aren't necessarily, say, licensed navigators, that they may have done a lot of different steps that might have constituted trying to apply for coverage. Because, that time of year when people are getting bombarded with messages and they want to know what they could do, they say, I need coverage. There's a lot of wrong pathways they can go down. So first and foremost, they tried to apply into healthcare.gov, but couldn't complete the application. There could be technical issues. You see that a lot on the last days of open enrollment. And maybe it was a little bit earlier before the end, but then, say they combines with a different step where they couldn't complete the enrollment and then they had exceptional circumstance or COVID or something like that. They tried to apply on their own, which is not necessarily limited to marketplace coverage. Say they attempted to enroll in off-marketplace insurance, or even for employer-sponsored coverage that wasn't necessarily right for them, especially if somebody was saying that this is marketplace coverage. Tried to apply for Medicaid. That one's pretty straightforward. We see that. That's been the one that Julia was just alluding to. But there's again a lot of ways somebody can try to apply for coverage, that they can be seeking health coverage for themselves, for their families, and a lot of ways they can end up with a situation that they think they have coverage, or they thought they did everything right, and the system has this mechanism for helping them out. Because again, the consumer didn't do anything wrong. They didn't do anything with ill intent or anything like that. They just wanted coverage, and they thought they completed the steps they needed to. So again, it's just a nod towards misinformation as well, and to watch out for that, because you want to listen to consumers and hear what they heard, what they believe somebody told them, what the person they were working with said, or the website they logged on to, because there's a lot of obstacles there, and this exists for that reason. So just a little bit more language directly from Michael Cutler. What I was just talking about is that they thought they would have coverage for 2022 as well. So again, if somebody thinks that they did everything, they thought they signed up for marketplace coverage, that even if they believed they were on Medicaid, but they didn't know that their Medicaid coverage ended, or that they were denied, or they believed their employer-sponsored coverage. That belief is important, and it's not as uncommon as you would think. There's a lot of consumers, especially with those junk plans, especially with those other products that come to us and say, I didn't know that I didn't have coverage until I went to the pharmacy, or I broke my leg and found out that my plan was only going to cover one hospital day, and now I have to pay $10,000. There's a lot of reasons, a lot of things that can happen. So just please listen to your consumers and find out what they tried to do and what they thought was going on during open enrollment.
Adam, you mentioned something about employer coverage, and I just want to reiterate that whether or not you have enrolled in your employer coverage, if you have affordable coverage that meets minimum value standard offered to you, you are not eligible for premium tax credits. So even if you missed it, that's not an opportunity for us to find some other special enrollment or qualifying event to get you onto the marketplace, because you're not eligible for tax credits.
Yeah, thanks, Julie. I would underline that even more if I could, just because it's one of the two hardest conversations we have to have as enrollment assisters, where somebody missed their open enrollment or thought it was unaffordable when the math problem said it was affordable. So those conversations are difficult for sure. This is something that is very fresh, coming out of the state's PHE, or Public Health Emergency Unwinding Task Force. That I really want to call to people's attention, especially people, sisters, and other people who are working with population that may have become Medicare eligible during the pandemic. So you may have, somebody who's been on Medicaid because of the continuous enrollment with the PHE, who was, say 64 and turned 65 during the pandemic. And right now, they will not get a special enrollment. So this is the part where we talk about not a special enrollment period. They will not get a SEP for traditional Medicare Parts A and B, so Medicare as you think of it, when their Medicaid coverage ends. So it's critical that they act and sign up for Medicare by March 31st. So very, very soon. So if you encounter anyone, if you work with this population at all, make sure that they are getting enrolled for Medicare, make sure they're getting the assistance they need with the ADRCs and the agents, Medigap helpline, anything they need to get enrolled by March 31st, because it's critical that they don't lose their coverage and have a gap until July of 2023. There's a link on here for the DHS Partner Toolkit that has more information on this, and other resources for reaching out to people and explaining some of the stuff, or sharing it on social media. So check out that link either in the materials, or I don't know, Courtney will drop it into the chat or whatnot. But please use those materials and let this population know.
Adam, before we move on to questions, something that didn't make it into a slide is that there are some times where we just cannot identify or get people enrolled outside of open enrollment. And we want to talk briefly about some of the resources for people who cannot get coverage. That includes accessing care at community health centers, where you can receive primary health care, behavioral health, dental care, sometimes specialty care, women's care, pediatrics on a sliding fee scale for those who qualify on the health center sliding fee scale. That can help cover you until an opportunity to get enrolled, or for households who aren't eligible to enroll in coverage. Also, there are free and charitable clinics, and every hospital system has a financial advocacy or financial assistance program or prescription assistance program. But for those who report to you that they have a large hospital bill when they were uninsured, they should always reach out to the billing department and complete the financial form that will hopefully reduce their bill.
Yeah, absolutely. And the financial assistance applications can be a pain, but hang in there with your consumers, make sure they get them in. And if they're having trouble, you can obviously help them. But if they're having trouble, first and foremost, if you're in that situation where somebody is dealing with a large bill, call the hospital, call the provider, talk to that billing department before it goes to collections. It's so important for the financial health, and then physical and mental health in the long run of a consumer that gets taken care of before it goes into collections.
One more thing before we do questions. I actually spoke to somebody during open enrollment who reported that back in the fall, he was in the hospital with COVID for a month and more, and that he had worked through a financial advocacy application and reduced his bill. And in fact, we identified that bill could have gone to the HRSA uninsured COVID program. So we were able to contact the hospital billing system and talk through that. So you never know what you're going to hear when you help consumers and really listen to their stories. Even 6 months back, things can impact how you assist them moving forward.
Yeah, and that's also just a nod to Julia. It's important to stay abreast as the sisters of policy and what programs and resources are out there. Because in a situation like we've had the last couple of years, there have been a lot of different things, and it's important to know what's available for a consumer to help them out. Okay,
Adam, the chats, I've not had it up because I knew it would distract me, but I think Courtney's been really busy over there in the chat.
Yes, we have some really great questions. So do you guys want to just go ahead and dive into those? I can go ahead and read them off.
Sure.
The first question we have, or the one that was upvoted or liked the most in the Q&A box, is regarding the coverage effective dates. So Vanessa asks, the first of the next month coverage effective date, is that just for the 150% FPL step, or is it for everyone?
Sure. It's important. Most commonly, you're going to see the immediate effectuation date with a loss of coverage where somebody acts before they've actually lost coverage. Like, that's usually where you find that, whether that's job-based coverage or Medicaid, that encompasses a very large bucket of consumers who will see an immediate effectuation date. There are others. There are some, especially this new low-income one, where that effectuation date is immediate. The COVID SEP last year, that special enrollment period that it lasted for months, had an immediate effectuation date as well. So there are circumstances where you'll see it. And then CMS has said, again, that this will be a thing in 2022 where it will be, I don't know if they've used the language of every single SEP or whatever, but they said they would be increasing to use more immediate effectuation dates, immediate being the first of the next month, not that minute.
Yeah, I want to restate that, because when you say immediate, that doesn't mean that if I enroll on March 11th, I'll get coverage that starts March 12th.
That would be cool.
The first of the next month.
Right. So when I always use that example, it's March 29th to April 1st. So like that's what you're looking for with an effectuation date that is that soon.
Great. Thank you both. And then we just have a clarification regarding the move SEP. So is moving within the same city as long as there's a different set of QHPs available? I think that just created some confusion about when that might be the case, that someone would move within the same city and there would be a different set of QHPs.
That's an interesting question. In theory, you'd be in the same county, so I couldn't imagine a new set of QHPs becoming available. And there are cities that span multiple counties, so if you cross the county line, probably it's possible. Yeah, I don't think I've seen anything like that I don't think that would work. Used to be you would hear if you change zip codes, but again, the QHP available has been a clarification that came out. So I don't think it would. I would certainly try it. I would certainly go into that application and see if it triggered one. But my immediate gut answer is no, I don't think so.
But remember, there's a requirement for prior coverage for that. So you're not going to be able to just move to a different county without having had coverage and be eligible to pick a different plan or to get enrolled newly in the marketplace.
There was a time years and years ago where that was a thing. But yeah, for the last 3-4 years, it's been you have to have the coverage, pre-existing coverage as well.
Great, thank you both for that clarification. And then we just had a question upvoted, so I'm going to raise that one up to the top about that last piece that you covered around folks who are currently covered under Badger Care and Medicaid through that continuous eligibility provision, but need to enroll in Medicare if they haven't already, if they became eligible during that time frame, and they need to enroll by March 31st. If DHS is screening for those consumers and doing any specific outreach to them, notifying them that they need to enroll by March 31st.
We are not DHS. That question is probably better suited for them. I can only imagine that they are doing everything in their power to alert those consumers. I was on one of the task forces, actually a couple of them, where they were doing a lot of communication. I don't remember the timeline for that communication, but I assume absolutely is the answer to that question.
Right. And I know they are partnering with some of their Medicare focused partners. So the SHIP contractors, folks through programs like the ADRC to do some targeted outreach to that group too.
Exactly. Yep.
Great. Thanks, Adam. And then there is a question about kind of this, a specific group of folks, so primarily immigrants. If there are any specific steps for individuals who are not eligible for premium-free Part A through Medicare or have not met the 5-year residency requirement, if they're not losing other coverage or don't qualify for some other step, what can folks in that situation do to enroll in the marketplace?
Julie, do you have any immediate thoughts on that one? Because I'm hearing you would need another step, right? Like,
yeah, you're eligible for premium tax credits when you're not eligible for Medicare Part A free. And we're seeing that more and more as the population ages. But the question is if that's the only qualifying event and you've been uninsured, again, screening and talking to their household about any other life changes they've experienced.
Yeah, there may very well be some changes of coverage, especially in a situation like that. And then also with the population, the immigration population that's been here for 5 years, you may see, you'd probably want to be looking for, again, a status change or potentially a fluctuation in income, especially with the new low income SEP too. You might see that works well for the population, because a lot of times what we're referring to is legal permanent residents who have been here for 5 years that are under 100% of the poverty level that are able to get tax credits on the marketplace. So you're really looking for any of the other steps that might go with that. But fortunately, again, if the income is low enough that you're in that population, you could get a special enrollment period now.
Thanks, Adam. And I just want to go back to our previous question about outreach to that Medicare group. Hannah also clarified that in addition to some of the other partners, the Medigap helpline is doing outreach to that group of consumers as well. So thanks for that clarification, Hannah. Our next question is from Ariana. If a person goes through a divorce and they're uninsured or they're insured through their spouse, will that individual lose their coverage right away when the divorce is finalized or after some other time frame?
Yeah, there's that. Oh, please go ahead, Julie. I was going to say I've seen some.
Yeah, that you need to look at your divorce decree and see when your coverage will end. That's something that is determined in the divorce proceedings, how long that coverage will end. And it also determines how coverage for children will be managed. And that's important to know. And to note the coverage years in which a parent will claim their child as a dependent, because I've worked with families where every other year dad claimed a child as a dependent. So every other year his household was 2 or 1, which impacted how much tax credit he qualified for. So those are all component parts of divorce.
Yeah, I saw something similar, Julia, whereas I have a divorce decree that basically said that the partner, the ex-husband, was going to provide the health insurance for the children for, you know, each year. And it made things very complicated in terms of looking at whether or not they were eligible for other insurance, because the marketplace website doesn't have an easy, you know, is there a divorce decree requiring that this person get insurance question? So those can become very tricky. So you want to know what the specifics are. And I can almost promise you that the consumer you're working with will know those specifics.
Great, thank you both. And then we have several questions about employer-sponsored coverage and affordability. So we'll get to all of those maybe together. But before that, the next one is if a person loses insurance through a group plan and their term provision, so when it ends, is immediate instead of the end of the month, they wouldn't be eligible for enrollment until the first of the month following that. Is that correct? This is like a specific question, I think, about an employer plan that ends maybe immediately in the middle of the month, when they would be eligible for the SEP.
That's a good question. There are a few circumstances in which you can get coverage to start in the beginning of in the middle of a month, I should say. I don't think that would work. I want to qualify that with, I absolutely could be wrong about that, but I would expect it to start on the first of the following month. But I would certainly be working with the call center, working with supervisors to see what options are available, and also be, you know, looking up, you know, all the resources I have at my disposal, including health reform beyond the basics, to figure that out. So I don't know the answer off the top of my head.
I don't have anything to add to that, but I know that there are several agents on our call as well. And I don't know if that would be a case for possibly seeing if you could get a short-term plan to carry you until a marketplace coverage plan will start. Because I don't know that, unless like the birth of a child will allow you to start coverage on the birth date. Yeah. But I can't think of any other opportunities to enroll in the marketplace with a start date that's not the first of the month. Or to request a back date. They've tightened up on requesting back dates of coverage.
Yeah. Yeah, there are probably some appeal situations where you might get a weird start date too. But yeah, the birth of the child was the one that I was thinking of too, Julia.
There's a good answer in the chat here. Thank you, Diane. Do you want to read that, Courtney? Sure. I can't keep my chat open because it.
Sure, yeah. Diane suggested or mentioned that she usually recommends taking the prorated COBRA just to cover small gaps like that.
Yeah.
Another good suggestion, in addition to maybe a short-term plan.
And with prorated COBRA, it's important to note that you can take it retroactively. I know because I've done it. So you have like 60 days where if you haven't taken the COBRA and something happens, you can pay for those full price for those months that you need it, as long as you pay for both of them up to the point where you had whatever happened. And so they don't have to make the decision immediately. They can. It's one of the few circumstances where they can wait to see if something happens. Like I did when I fell in the ice and split my head open and said, I need COBRA.
Great. Thank you both. And then, like I said, we have several questions about the employer affordability piece. So we did share the employer affordability worksheet from Covering Wisconsin in the chat. But if you all could just review again, sort of how that calculation is done. We have some questions about if it's compared to the lowest cost plan offered to the employee. And that's the cost that you would use for that calculation, no matter what plan they selected. So maybe just reviewing again, kind of how that calculation is done would be helpful.
Sure. Julia, do you want to take that one?
Well, I have a feeling that part of this question relates to my example in which there was only one plan offered and it was not the lowest cost plan option on the document. It was expressly crossed out. In that scenario, to me, that meant that she was not eligible to enroll in a plan other than the one that was being offered to her. And that plan was unaffordable. Adam, do you have more to say about how to assess for the lowest cost plan and how to look at documents?
I mean, sure. I start, talking to the consumer. Oftentimes they'll bring the documents, but a lot of times we will follow up directly with, the office or the human resources department, whatever it is, to see what the full offering was. And you'll want to see the lowest cost plan that was offered to an individual. So again, that we have that family glitch issue where if they need the family coverage, they're still only looking at that lowest cost, lowest premium plan offered to an individual, and then running that against their household income, their gross household income, and seeing if it is, what's the current percentage, Julie, 9.61? 9.61% or less is considered affordable. So you're going to want to, if that plan's affordable, then you're having one of those very difficult conversations where either if the person didn't take it, again, your coverage options are extremely limited, if not non-existent, or if they need to cover their whole family and they're in that family glitch territory where they can't get tax credits on the marketplace. So typically I start with getting the documents. That's number one.
Can I just share with you that years ago, I had a gentleman come in to our office in the summer. He had enrolled himself onto the marketplace by calling the call center and reporting that he didn't have employer coverage because he had missed his open enrollment. And by the summertime, when the IRS and healthcare.gov did their data match where they reach out to employers to say, essentially share with us who's eligible for employer sponsored coverage. And they saw that he was receiving tax credits instead of being on his employer health insurance, and the employer verified that he was eligible. The IRS was asking him to repay back the tax credits.
Yeah.
And it was to the tune of thousands of dollars. And he comes to me with an IRS letter and says, what can I do?
Very little protection.
I will not facilitate. That stuck with me. And I really, as much as I hate to not see a coverage option for you, there could be great harm done in you getting yourself on the marketplace.
Right. And it sounds like that's ignorance, as opposed to frauds, which is, one thing. But again, it doesn't necessarily protect you from the repercussions of that. And employers do verify because they have their financial implications for them too on the back end if they aren't offering affordable coverage.
Now you could go onto the marketplace without tax credits and pay full price if you qualified for some other SEP, but you're just not eligible for premium tax credits.
Right.
Great, thank you both. And I shared again that affordability worksheet in the chat since I know that was helpful for some folks and includes that current percentage too. We have just under 10 minutes left, so I'm going to share the evaluation in the chat in a second. Again, for everybody, if folks have to leave us before 10:15, but we have 3 more questions right now, and the next one is related to kind of Christian or other religious-based plans. And if those are not considered MEC or minimum essential coverage, do folks qualify when quitting that plan for a SEP, or do they have to wait to enroll during open enrollment? So
you'd qualify to receive premium tax credits, but you'd have to identify some other SEP to get you entry into it because you're not losing minimum essential coverage.
Right. But you might see, related to what we're talking about, pretty easily, I think, a consumer who definitely thought that counted as minimum essential coverage. So depending on how that was presented to them, you may have a SEP under the one of those technical ones, misrepresentation, or thought they had insurance. So I would absolutely expect to see something like that with one of the health sharing ministries or sharing plans.
It's worth having the conversation with the call center.
Yeah, definitely.
Great, thank you both. And then our next question is related to someone, if someone has a child support sanction through Medicaid who would otherwise be eligible for Badger Care, are they eligible to sign up for Marketplace with an APTC, and would they ever qualify for a SEP?
I don't think they would get an APTC. I don't think the system looks that closely at it. They're going to look at the income and the other requirements and say, yep, you could have gotten Medicaid. So they're not going to trigger an SEP. I don't know of a specific SEP that would apply in this situation either. there's probably in that situation like that, depending on when they come, there could be a lot of other factors in play that would be worth looking at. That's certainly not something I would take lightly or quickly. But yeah, I wouldn't expect them to be able to get APTCs, but again, I'd certainly be assessing and listening for everything I possibly could in that case.
Okay. And then our last question for now, we do have about 5 more minutes. So if there are other questions, feel free to put them in the Q&A. And this is from Vanessa, who has a consumer who's married to an immigrant who used to be a full-time student under an F1 visa. The consumer sent 2 statements explaining the situation and that his wife does not have legal status yet, but the marketplace continues to ask for a social security number for the wife, although she does not qualify for a marketplace plan. And Vanessa's saying it's a data matching issue, a DMI, but the marketplace seems not to accept the explanation that's being provided by the consumer. Any suggestions? This is a longer one, so if you need to look at it in the Q&A too, it's there.
That might be something we want to take offline.
Probably. Yeah, I always tell, I mean, just as one of my rules of thumb is when I'm working on similar situations that, like, if the marketplace doesn't need the social security number and I don't think it'll help, in this case, it doesn't exist. I tend to not to focus on the applicant who needs the coverage or who's eligible for the coverage. So I would, want to take that one offline, look at the details before making any kind of call that would mislead people.
Well, and I'd also want to make for sure that you're indicating in healthcare.gov application that you're not seeking coverage for that person.
Right. That's what I was getting at. Yep. Thank you.
And then I did see, just a reminder that both Adam and Julia did graciously put their email addresses on this last slide. So if you don't already have their email addresses, you'll see it there, and then you'll also see it when we send out the PDF of the slides. So if you do have additional questions, feel free to reach out to Adam and Julia via email as well. And I'm not seeing any other questions right now in the Q&A. So I'm going to once again just share the evaluation link in the chat. Let's see. I did see one other question come up in the chat related to the Badger Care and Medicaid denial SEP, and just asking to clarify if that denial has to happen during open enrollment. So if they have a denial, for example, this month, would they qualify for a SEP?
So then I would go back to looking at that attestation. Did you apply for coverage between November 1st and January 15th? And this is where these conversations that include looking back, even if you're in July, to go back, what happened? Did you try to get coverage during the open enrollment period, and listen to what your consumer's response is. You can't lead them or prompt them to provide the attestation that will open the door. But if you're hearing that efforts were made and they were unsuccessful, and now they are here again trying to get coverage, you might be able to package that in a way that results. And it doesn't necessarily, I think we've talked to people that it doesn't always work,
right?
But it's worth trying. And I just wanted to clarify what that question in healthcare.gov means and how you can accurately use it and feel confident that you're answering that correctly and for the right reasons.
Yeah, and I will say you could have someone come to you in July who again absolutely thought that they had coverage, or even marketplace coverage the entire time, but they hadn't had to use it until then. So it's certainly something that you have to listen for. And again, hear what the consumer said, because they'll tell you for sure.
And just because we have 2 minutes left, so just a reminder to complete the evaluation. That link is in the chat. I did scroll up and see one question in the chat, sort of unrelated to SEPs, but just your advice on who best to contact at DHS or IM if you have a family who became eligible for Medicaid or Badger Care. I'm in this example back in January, but they haven't yet received information from DHS about that coverage.
I would start with the income maintenance, the IM consortium on that one for where that consumer lives. because they're going to be the ones who could produce all the notices and things like that. DHS has some part of it, but they're the ones who will say, yep, this person's eligible. It looks like nothing has gone out. We'll resend that.
Great. So following up with the income maintenance agency or Miles.
Yeah, or Miles if it's in Milwaukee, correct. Yep. That is the state, I guess.
Great. Well, thank you all so much for joining us today. Like I said, the evaluation is in the chat. We'll also be sending out an email with the slides and this recording and that evaluation link again. Thank you all for joining us, for sticking around. We had almost everybody stick around till the very last moment here. And thank you to Adam and Julia for a great presentation and for a really good Q&A.
Yep.
Right.
Thank you. And the final words are, keep referring to Enrollment Assisters, because we're trained to have long conversations, listen for those triggering things that might help you get enrolled. So keep them coming.
I love that, Julia. Thanks.
Absolutely.
Yeah, definitely. Outcomes are better with enrollment assistance, and we're available for sure. Thanks, Julia. Thanks, Courtney.
Thank you
Bye.
both. Happy Friday.
Yeah, you too. Bye, everybody.